We're really at an important point in the history of Medicare Advantage because we have about half of the Medicare population choosing to enroll in Medicare Advantage today. So understandably, it's under a lot of scrutiny and policymakers are taking a closer look at it. And so I see three broader themes if I were a Medicare Advantage plan that I would be paying attention to. The first is value. So CMS is really looking at the program and trying to understand what is the value of the dollar that the government is getting as it purchases these Medicare Advantage services. They're looking at it in terms of what CMS is getting, but they're also looking at that in terms of what beneficiaries are getting and what providers are getting. And related to that, we should expect to see increased scrutiny on rates, risk adjustment, and payment to Medicare Advantage plans. CMS has evolved the payment model for Medicare Advantage throughout the history of the program, and they will continue to do that to ensure that the dollars going into the program are commensurate with the costs associated with providing high-quality care to these people. And then finally, and I would say related to both of those, is consumer experience. So what does it mean to be a person who's enrolling in Medicare Advantage? What does your person-centered experience look like? What does transparency look like around that? I would expect to see increased scrutiny on things like provider networks, provider directories, outcomes associated with person-centered care. So really a host of policies that the administration is going to be looking at for Medicare Advantage because we are at this really important juncture in terms of the program's growth.